Hello all, I hope you all are doing good. Welcome to Mitra's 87th webinar. The topic for today's session is Relevance and Evidence-Based Rationale in New Treatment Paradigm for Children with Autism. Today's session is presented by our esteemed professional, Dr. Samraj Johnson. Dr. Samraj Johnson is occupational therapist, sensory integration therapist. He is a professor at Osmania Medical College. He is also founder of Kites Child Development Center, Hyderabad, India, and founder of Kites INC, USA. Sir, we are very happy to have you on our forum. A very warm welcome to you.
Yeah, hi, Saujanya. How are you doing?
Doing good, sir. How are you?
Doing good, doing good. Thank you so much. Thank you. Hi, all the parents and happy Women's Day. I've got a very great regard for women's in terms of the way you guide, mentor, and guardian the children in the society is something unparalleled to anything which can exist on earth. So happy Women's Day, stay blessed, and God bless you all. So as Saujanya mentioned, the topic for today is all about the new treatment techniques which are coming in, the evidence based behind it, and let us try to understand what are these new terms or new techniques, new words which you are hearing in terms of treating a child who has been diagnosed on autism spectrum or Downs. Both of them, because Downs kids nowadays have been found to be having a comorbid autistic spectrum as well. So nowadays they are clubbing autism spectrum as well as Downs together. So this particular topic, maybe again we will continue this plausible topic for another 2 or 3 sessions more, because it's not going to end in a day. And let us look at all the possible interventions which we keep hearing about and which we keep approaching in terms of taking help, expecting that there would be some hope and some help for our children who have been diagnosed on the spectrum. So the first thing which we have by large discussed, there are 5 things which predominantly come into my head. The 5 things, or maybe 6 things. The 6 things which predominantly come into my head. The first one is that sensory integration therapy and manipulative therapies, which go hand in hand. Sensory integration therapy and manipulative therapies, and under that, the Wilbur-Jar or Terasuit or the craniosacral therapies, which fall under sensory integration and manipulative therapies. Those are the 3 things. So if you come across people stating that Wilbur-Jar techniques or Terasuit model or craniosacral therapy, that is nothing but sensory integration therapy for you. And the second one, which predominantly again I hear about, is reflex integration therapies. And when it comes to reflex integration therapies, we hear about MNRI, right? MNRI is nothing but Mozgutova neurosensory integration, reflex integration, Mozgutova neurosensory reflex integration. MNRI is one technique, and another one is reflex integration in that. And the third one is that rhythmic movement training, wherein a lot of people will, in terms of include dancing, include brain gym, not brain gyms, include dancing and these movement patterns by different sports and different extracurricular activities which we talk about, predominantly fall in this reflex movement training and rhythmic movement training. And the other one, which is listening therapies, right? Most of the parents are nowadays going for this listening therapies, and I keep hearing from parents in terms of asking me queries about how far it is by large, how far it will be useful for the child. So when you're talking about listening therapies, the things which usually come under the different terms or which come under listening therapies are auditory integration therapy, the listening program, or therapeutic listening. And these are the 3 main things which come under that particular category. And another one is movement therapies. When you say movement therapies, we come to hear more about brain gym and interactive metronome programs, metronome metronome programs, yeah, and Makota therapy. These are the three by large which we again come across by large, the terms which we come across or the different names which we come across would be that. And the other one is ABA, all of you are familiar with. And the sixth one is probably about the nutritional, the nutrition and the effects of the nutrition and how it plays a role in terms of treatment, categories. Now, the important point. Are these all scientifically approved or all these all evidence based? The point, there is a very small thing which I want all the parents to know. Whenever we talk about evidence based practice, evidence based practice means it is based on integrating critically appraised research results. Like, there are a lot of researches which have taken place in these studies and a lot of researches which are going on in these studies. So integrating all this critically appraised research results with the practitioner's clinical expertise and clients' preferences, beliefs, and values. I mention it like I'm repeating this particular thing because it's very important for you to understand what is actually what do you mean by evidence based. Evidence based is nothing but all the researches cumulatively taken together and the critically appraised results which are embedded through that particular studies along with the practitioner's clinical expertise and clients preferences, beliefs, and values. So this is a classified definition of evidence based practice uh, by American Association of Occupational Therapy. Okay. uh, so there is no treatment modality which exists. If there is a treatment modality which exists without this research studies behind it, then that is not evidence based. But if there is a substantial research which has taken place, then it is called evidence based, but it is not scientifically proven, because all the evidence based studies, evidence based practices, unless and until it is not scientifically been approved, they cannot be called as scientifically approved studies, but they are evidence based practices. So far all these studies whichever I have mentioned, reflex integration therapies or listening therapies or movement therapies or sensory integration therapy, all these practices are evidence based practices. So whenever you say evidence-based practices, again, as I said, it is about the practitioner's clinical expertise, like, how far that particular practitioner has got knowledge into that particular area, and it is client's preferences, that means the parents' preferences, their beliefs and their values which are associated towards that study, then only you can take it forward in terms of implementing it on the child. So let us see what is this reflex integration therapy all about. What is this reflex integration therapy all about, and how much important it is in terms of taking a child forward to become independent in all the areas of their functionalities. Now, there are many studies, there are many studies which have come across uh, in this particular area, uh, which says that if reflexes are not integrated, reflexes are not integrated, then that means the basic foundation is not in place. Again, like the way we spoke about sensory integration therapy, like the way we say that sensory processing and sensory integration is the foundation for the development of any other skill. The same way the reflex integration therapy, reflex integration also, they say that it is a foundation. It is a foundation step for any proper growth to take place. And the so-called the founder, not the so-called, the founder of MNRI, that Musgudova method, she is a lady who has done her PhD, and precisely in her PhD studies, she has studied on this reflex integration, and thereby she has established this particular reflex integration program and adapting different techniques in terms of implementing this reflex integration program. And she has come across with a term called as reflex integration disorder now. Like the way we say sensory processing disorder, there's something now called as reflex integration disorder, which is of course not been what do you say? It is not been established in Diagnostic Statistics Manual, DSM, or ICD. The classification has not still taken place, but she has come up with this term called as reflex integration disorder, and she has got her own base for it. And there are a lot of studies parallelly which have taken place, and alarmingly, many of the studies, probably you can go back and look forward for yourself how many studies have taken place in this particular field, and what were the results of it. So if you really see a child who is been, by large, what they say is a child who is being diagnosed with autism spectrum disorder or ADHD, they still have got certain retained primitive reflexes. That means the reflexes are the, what do you say, are not integrated by certain level of time, but they are still continuing with the child, and that will limit the progress of the child. That will limit the progress of their learning capabilities and learning areas which are concerned in terms of their learning. So most of the studies have come pretty much closer in terms of like a child who is diagnosed with autism spectrum disorder. There are three primitive reflexes which the child. There are three retained primitive reflexes in them, and they are symmetrical tonic reflex and asymmetrical tonic reflex and tonic labyrinthine reflex. These are the three reflexes near about 90.3 percentile of children. In most of the studies, between 80 and 90%, most of the studies, they are found to be having these three retained reflexes in them. And when you talk about ADHD, they say that there was one beautiful study which was done for a group of children between 8 and 11 years of age, and they say that the ADHD or their inattention or their hyperactivity is all because they have these retained reflexes called as Moro's reflex and Gallant reflexes. So there was one beautiful book also been written by Sally, and the name of the book is called Reflexes Learning and Behaviors. Reflexes Learning and Behaviors, and she has very clearly explained in that particular book, stating that how this reflexes, this retained primitive reflexes, if it is crossing beyond the age 3 years of age, how it can affect the child. So I've just given you a gist behind what this reflexive integration therapy is all about. And now let us understand what is a reflex first. What is reflex? Let us go little deep into reflex integration as such. What is a reflex? A reflex is an automatic instinctual movement, right? Automatic instinctual movement that assists in development, growth, and survival. So it is that basic paradigm which helps a child to progress forward, because it's more of a protective in nature, and because it is protective in nature, it teaches a child a lot of other skills which need to be formed on this particular foundation. And many reflexes are active throughout our lives, and other reflexes which we call are primitive reflexes, which start in the womb and infancy and are designed to become inactive after certain period of time. And predominantly that after certain period of time is toddler's age. Like, they are developing in utero, in the womb, or as soon as the child is born, and after certain period of time they become inactive and merge into more sophisticated movements and become integrated. And when you say integrated, that means this child will not have this particular primitive reflexes are no longer active in that child. And why these reflexes are important? Reflexes are predominantly important for the development of balance, posture, strength, and mobility. That could be gross motor and fine motor skills, and vision, hearing, speaking, social emotional skills, learning and communicating. So if you see, all the components are embedded, right? All the components of child development are embedded. And if these reflexes are retained, that means these are the areas which get affected in a child. These are the areas which will remain as a vacuum in a child. And the learning hierarchy which they have established, the learning hierarchy, I think it was this learning hierarchy was given by a brain gym instructor, maybe in 2008 or something, around that particular time. She's from Australia. She's called Claire. Okay, she has given a beautiful learning hierarchy for this, and the first basic foundation in that is primitive reflexes. And primitive reflexes, they say that it is for the development, integration, and inhibition of survival reflexes. There is a first step: development, integration, and inhibition of survival reflexes is the first stage. Next comes is postural reflexes. Postural reflexes is nothing but the ability to be in upright posture and balance your body against gravity, the forces against gravity, balance your body. Upright posture and balance is the second step which they mention in that. And the third one is the motor patterns. And motor patterns is how volitional the movements become, how good the motor patterns are coordinated in a child. That is the third step which they take. And the fourth one is perception. Perception is nothing but development, integration of senses, all the senses. Like, that's where the sensory motor development plays a role in this perceptual category, according to them. And next one is language, then conceptualization, then higher level of functioning, the executive level of functioning. So if you want to pen down, I'll just give it this again to you: primitive reflexes, postural reflexes, motor patterns, perception, language, conceptualization, academic high level functioning. So this is the bottom top level. This is the bottom top level. But unfortunately, what we really do many of the times is we really don't look in these areas at all. We don't really understand the importance of these particular categories which are established in this, and we keep working, or we keep focusing upon making child speak, making child communicate, making child write things, making child understand concepts. But if you see, conceptual making is right there on the top. And if these things, the bottom to top level is not that learning hierarchy, if that hierarchy is not been followed or fulfilled in the child, that means the last 2 points, which last 3 points to be precise, like language and conceptualization and higher level of functioning, is where our focus will be most of the time. But in order a child to perform good in those three areas, these are the bottom things which you need to fulfill in the child, and you need to address these bottom things. And if the foundations, uh, the primitive and postural reflexes, if they are unstable, if they are weak, or if they have gaps in their development, they will undermine all other levels to some degree or the other degree, is the complete concept which reflex integration therapy revolves around. As I said, if this particular primitive and postural reflexes, if they are unstable, or if they are weak, or if there are gaps in their development, that means they will undermine all the other areas of functionality. The motor, perception, speech, and conceptualization will automatically become unstable, and all of them can work hand in hand in terms of development of the child, causing the higher level of functioning areas to be affected by large in them. Okay, although these stages do overlap to a certain extent, if the stage is missed, or if the stage is interfered with or not fully integrated, it can prevent the full development of the subsequent stages, the next steps. That means if primitive reflexes are not if not integrated, that will have an impact on postural reflexes. And if postural reflexes are not developed, that will have impact on perception. And if perception is not developed, that will have impact on language, conceptualization, and academic skills. So that's the logic behind reflex integration for you. And unfortunately, if these are retained, a child will not grow out of their established learning and behavioral problems. their learning skills and the behavioral problems, they will not come out of it. Okay, the problem may here there is small thing. The problem may alter and appear to improve as child learns to compensate. As take my word, child learns to compensate in other ways, but the weakness in the system will remain, causing stress on that particular system altogether. So, even though if that particular skill, even though if that particular primitive reflex is retained or the postural reflex is not yet developed, child might still be able to function. Child might have learned how to compensate, how to compensate for that particular deficit and still work, but the weakness in their system will still be there and it keeps interfering in their learning process. Okay, and to tell you very frankly, reflexive movements are the first foundation for the development of nervous system, for the development of the nervous system, because reflex originate in the brainstem, or they call it a survival brain, right? Brainstem or the survival. So they originate from the brainstem. When reflexes remain active, the survival brain is constantly stimulated. That means if you have retained primitive reflexes, that means your brainstem is still in an active movement, and there is less ability to access the prefrontal lobe. What does it mean? Like, brainstem, and from brainstem, if you go up, you go into the frontal lobe and prefrontal lobe areas. And when you say frontal lobe is considered to be the lobe which helps us in terms of executive functioning, right? So that means if the child is having retained primitive reflexes, that means at the brainstem it is still active, so the information is not going up to the level of frontal lobe, so thereby there is a compromise in terms of this prefrontal lobe areas, which helps us in thinking, creativity, communicating, and make beneficial to make those beneficial decisions will be predominantly affected. This unintegrated reflexes always keep triggering the flight or fight responses in a child, creating a chronic stress around their and in their environment. So they're constantly under flight or a fight mode. Okay, if they have unintegrated primitive reflexes, when reflexes are active, our body parts cannot easily move independently because you have not developed postural reflexes, nor you have developed motor patterns to use your body effectively to accomplish a task. So that much of an impact an unintegrated primitive reflex can have. Like to probably say a movement of the head. Whenever you move your head, there is an automatic movement which takes place in your limbs, hands, and these extra limb movements happen below the surface level, and there is a confusion which is created in the neurosensory motor system of the child, and this confusion creates difficulties with growth, with coordination, with reading, writing, speaking, thinking, you name it. This particular confusion will not allow the child to take them where they can work with their frontal, where they can bring their frontal lobe into functionality at all. A child, probably a child who fidgets in a chair, a child who cannot focus, is more likely suffering from this active reflex. This is what they say. Likewise, I said, Moro's reflex and Gallant reflex, which will cause, which they say, because they are not integrated, probably those signs and symptoms of ADHD takes place in those children. So that's what they say, like, a child who fidgets in a chair or a child who cannot focus is more likely suffering from active reflexes. And once reflexes are integrated and head and limb muscle groups can move more independently, then the ability to sit attentively without fidgeting comes very easily for the child. So that's the bottom basic line which they give. Their sitting tolerance and being ability to remain focused in doing the task can be by large disturbed if these primitive reflexes are retained or if they remain unintegrated, because they will not allow the child to move or to function with their body independently. And active reflexes cause aches and muscle tensions in some children, or they affect the muscle tone. If the reflexes are not really good or not integrated, or not, if they are still in a retained phase, then it will cause an effect on their muscle tone, and they fatigue easily. And usually these children need for great amounts of efforts to complete a task in comparison to other children. Okay, so though primitive reflex movement patterns are present in normal developing infants, ideally most are integrated. That means they are no longer active, or they are inhibited by the end of 6 months to 1 year. Usually, all the reflexes, all the primitive reflexes which develop in utero, and they need to be integrated by age of 1, which is precisely, if you see the development of a child, by the time child will be able to stand or will be able to take few steps, pull himself to stand, and will be able to walk with support, and things will start working. That means that is a time where there is the motor patterns start establishing. And if there is a delay in gross motor development, and if there is a delay in where child has not still achieved these motor patterns the way it should be, that means child is still having these retained reflexes, or the primitive reflexes are not integrated in this child. Okay. uh, there is a relationship between retained primitive reflexes and sensory integration. Likewise, I said, like, in their hierarchy, they are very clearly mentioned. They mention very clearly, stating that, first is the primitive, then comes the postural reflexes, then the motor patterns, and then the perception. Then the perception, where they talk about the relationship between these established motor patterns and the way they receive information from the environment, and how they work hand in hand in taking the child forward. And the retained reflexes affect the process by which our brain interprets sensory information that we gather from our senses. So I hope you are getting me. I hope you are getting me. Like, if these retained reflexes are in place, that means a child is not able to modulate the information which is receiving from the environment. So it is actually not making the sense the way it should make. So thereby, the responses become a problem. And the response problems can reflect muscle control concerns like balance, touch, hearing, vision, and proprioception. These are the four basic senses which we talk about when we talk about muscle coordination, balance, or equilibrium, or writing reactions, right? And these are very crucial to mature, and for an appropriate behavior, appropriate learning to take place, and for complete future well-being of the child. So if your primitive reflexes are not integrated, that means what eventually is happening there is the information what is being received through environment by different senses is not modulated properly to the brain. Thereby, the responses in the child are not the way it should be. Either the responses are under or over, like, hyposensitivity or hypersensitivity. So the responses will vary, and it will have an impact and make a child look like either he is daydreaming, or he is not concentrating, lazy, defiant, uncooperative, or in fact dyslexic and ADHD. And there might be a constant efforts being kept by child, parents, and therapists or teachers, but still these areas remain as a concern because of these retained unintegrated primitive reflexes and their correlation with sensory processing. So, what are these sensory red flags? Please pen it down, and if you really see these red flags, the sensory red flags, because of the reflexes not being integrated in the child, retrospect yourself, and if these are there, so I think you need to change your strategies to work with your child. Maybe they will benefit by adapting this kind of modalities. Like the first and foremost is, they say, like, 83, if I'm not wrong, yeah, around 83% of children who have been diagnosed on spectrum would have missed out crawling, or they would have had very minimal time of crawling. But they are early walkers. They are early walkers. Like, the basic category, this particular thing supports this particular study now. The reason behind that is, if crawling is not there, if the child has not attained that step of crawling, that means he has not overcome many of the primitive reflexes. So that is one of the indicators. So the sensory red flags would be difficult with cross crawling, skipping, hopping, and jumping, clumsiness in catching and throwing a ball, difficulty manipulating scissors, pencils, beads, laces. These are the other components, and uh, uh, trouble with games which will have instructions, or following group rules will be difficult for them, and they will be unable to sit still, or they are always on the toes. A tendency to be fearless, like, climbs high places and stuff like that, jumping on the sofas, just keep climbing on from one area to other, and tendency to be clumsy or bump into things, or they keep dropping things, and they will have fear of the swing, slides, high places, and elevators, the gravitational insecurity, and there is a pure poor sense of rhythm, or they fall easily and often, and walks with very uneven gait, and there is an unusual quietness or lethargy in these children, and constant interrupting. Uh, like, they won't wait for their turn to speak. There is a constant interruption, and or they will be having persistent chattering, often unrelated to the topic, and excessive repetition in speaking would be there, and these children will have behaviors getting worse in crowded and noisy places. There is a confused sense of time and distance, and they will have huge difficulty in following a sequence. That could be a picture, event, or ideas. They'll have a huge difficulty in sequencing a task. So thereby, their activities of daily living, which involves the sequence of tasks, will be by large affected in them. So that is. Those are the red flags which you have to look in terms of relationship between uh, primitive reflexes, retained primitive reflexes, and sensory processing concerns, how it can affect. So, if your child is having any of those any of those red flags which I have mentioned now, that means they might be still suffering with retained primitive reflexes. So, unless and until you don't work in terms of integrating them or developing the postural reflexes, that means learning cannot take place the way it should be. And let us see the relationship between primitive reflexes and challenging behaviors. They have established that particular component too. What is the relationship between primitive reflexes and challenging behaviors? And as you know, the challenging behaviors is a term which is used to describe those behaviors that threaten the quality of life and the physical safety of the individual, right? The quality of life is affected, and the physical safety of the individual is affected, and it is impossible to cultivate positive attitudes and beliefs when we are stuck in this primitive reflex stage, or the reflex or the reactive stage. you know so our rational mind is nothing but a frontal lobe. Our rational mind is completely disengaged. We are not able to allow our brain to think and act, but you are acting impulsively. So that's where that reactive or reflexive means, there is an impulsive act, but you are not allowing the brain to rationalize your actions. So if the retained primitive reflexes are there, that means child is going to have challenging behaviors. That's what they mean. And retained reflexes prevent the communication between the left and right sides of the brain, and help this communication taking place effectively. And usually what they do is, because they don't allow this communication to take place between two hemispheres of the brain, they call it as, if retained primitive reflex is there in a child, that means brain is functioning at only one level, and that is called one-sided or homolateral functioning. And complete dominance of brain, eyes, ears, hand, and feet may not be developed the way it should be if they are having these retained primitive reflexes. And children with challenging behaviors often show homolateral behavior with incomplete brain dominance profiles, is what they say. Like if you really see their ambiguity in terms well, not ambiguity, their dominance not being clearly established between their left and right hand could be one of the basic sign to tell you that child is still having unintegrated primitive reflexes. It is that correct reflex and sensory integration that forms these neural connections and matures the frontal lobes. And brain usually, if you really look into that, the myelin sheath which is involved in uh, establishing the functionalities of the brain, important for the brain to function properly. This particular correct reflex integration and sensory integration together will establish a neural connection which improves. But if you really go by research and see ADHD kids, they usually say that approximately there is a 10% less electrical activity taking place in their frontal lobes, and the frontal lobe is smaller in size. That gives a clear indication. These are all research based. Whatever I'm saying is all the research which has been established in many papers and by many scientists and many workers who are interested in that field. So thereby they say that because the frontal lobe is not been established the way it should be, the communication is not happening properly. So it will not help the child to develop postural reflexes which aid them or help them for their well-being. Okay, so to say in other words, for a person to be competent learner and completely functioning in everyday life activities, they need to have correct and proper behaviors, and the ability for the frontal lobe, which is responsible for logical rational thinking and behaviors, or for mature abstract thoughts and behaviors, or for the self control, anger management, and obeying and conforming manners, and their motivation, resilience, contentment, happiness, adapting transitions, their temperament, their ability to organize and plan, which are all the functionality of the frontal lobes, will by large get affected if the retained if the reflexes are not integrated and working alongside with sensory processing abilities. That means reflex integration and sensory integration, if they don't take place, they're not allowing the frontal lobe to play a role at all in their everyday life functions. And all those functions, whatever I said, are the things which can go wrong. And they have given certain behavioral red flags which are there because of retained primitive reflexes: aggressive outbursts, temper tantrums, emotionally reactive, be uncooperative most of the time, make unreasonable demands and injure themselves, and be extremely noisy. They keep shouting at others, display physical aggressions, disregard rules, manners, and social conventions, and this physical aggression towards others predominantly will be kicking, biting, slapping. These are certain red flags play a vital role, which play a vital role in terms of unintegrated primitive reflexes, and not developed sensory integration properly. And let me, uh, Saujanya, Saujanya, should we continue this in the later, or should I go ahead in terms of explaining the what are those reflexes which can play a role, and how to identify if that particular reflex is not established?
As you please.
Okay. Maybe I'll just give them two or three reflexes this time, and probably we can go to the other reflexes and how it is in the next coming webinar. Okay, so the first reflex which comes to mind is this reflex is called fear paralysis reflex. It is called fear paralysis reflex. Usually, this develops between fifth and eighth week in utero. Ideally, it is integrated before birth itself. And fear paralysis reflex is most likely a protective mechanism in face of danger and helps us learn to cope with stress. So, fear paralysis mechanism, I'll repeat, is most likely a protective mechanism in face of danger and helps us to learn cope with the step. And it is something we call it as a freezing reaction. This is called as a freezing reaction. And if this particular reflex is not integrated, it will not allow, or it will interfere with the integration of Morose reflex. And possible long-term effects, uh, like if this particular reflex is not integrated, the possible long-term effects would be, there is a shallow, difficult breathing. There is always an underlying anxiety. There is an insecurity and social esteem. These children are always isolated or withdrawn. They're constantly feeling overwhelmed. There is extreme shyness and fear in participating in a group. There is a huge fear of separation from the loved ones and clinging. Like separation anxiety, like you cannot get them separated from their loved ones, especially most of the scenarios it would be mother, like mother needs to be there for them to perform. And if your child is having that, then that means fear paralysis reflex is still not integrated in them, and usually these children will have sleep and eating disorders, and they will have elective mutism. When you say elective mutism, in other words, it's nothing but like, you might be asking them, a mother might have brought her to a stage where child is able to speak 2 or 3 words together, but if somebody is asking, there is an elective mutism there. They will not be able to give that. So this elective mutism will be there, and there is a low tolerance to stress, and these children usually withdraw from touch. They will not like touch at all. They are hypersensitive to touch, and they have problems with aggression or controlling behaviors. Usually, these are more towards craving attention, and there is an extreme fear of failure for these children, and they usually develop phobias. If all these things are not addressed, they usually develop phobias. So this is all about that fear paralysis reflex. So you can see, like, one small primitive reflex, if it is not integrated, how many areas it can affect the child with. And let us see Moro's reflex. I think most of you would be knowing Moro's reflex, because it is something which develops 9 to 12 weeks in gestation and usually integrated by 4 months of time. And it is an automatic reaction to sudden change in sensory stimuli. That could be, bright light, loud noise, touch, change in body position, or change in temperature, so forth and so on, like that. And these can trigger that Moro's reflex, that startle reflex, and it creates instant arousal of the body's survival system, right? The Moro's reflex trains the brain's nervous system in developing this flight and fight mode. And usually, an unintegrated Moro's reflex is often accompanied by hypersensitivity to incoming stimuli, and usually these children will also have health concerns, comorbid health concerns in terms of allergies and in terms of asthma. And if let us see if usually Moro's reflex is not integrated, possible long-term efforts, that number one would be sleep disturbances, and that is the most predominant thing which you will see. The sleep disturbance, a small sound in the room can give this survival instinct, or awake, or make their complete system active. Okay, so sleep disturbances is one of the thing which happens, and easily triggered anger, and there will be a lot of emotional outbursts in these children, and these children will have poor balance and coordination. Their stamina is poor, and there is an increased sensitivity to light, movement, sound, touch, and smell. So a child with retained primitive reflexes in terms of Moros are mostly categorized into hypersensitive kids, and they will have difficulty with vision, reading, and writing, and difficulty adapting to changes is one of the biggest concern again for them. Okay, usually these children will show you a cycle, a pattern of hyperactivity and extreme fatigue. They sound active at a moment and they suddenly sound, they're fatigued out, and they are easily distractible because of their hypersensitivities, and they will have difficulty in establishing bilateral coordinated movements of body. By example could be, just throw a ball at your child. If he's not able to catch it, just understand that Moro's reflex could be one of the reason. Retained Moro's reflex could be one of the reason. And these children will usually suffer with visual perceptual skills. And the ideal way they say is that most of these children, if you introduce a fluorescent light, they will not be able to tolerate. So that is another one way which you can really really see whether Moro's reflex is retained in them or not. So Saujanya, probably I'll end it here. In the next session, we'll talk more about these reflexes and their possible long term, and then how they need to help in terms of integrating these reflexes. Yeah. Saujanya, thank you so much. And I wish all the mothers happy Women's Day once again. All of you stay blessed and God bless our children. Thank you so much.
Thank you, sir. It was a wonderful session and very informative and helpful to many parents here. Thank you so much for your guidance and giving us your time. Thank you, sir. And
Thank
thank
you.
you all
Thank
for
you, Saujanya.
joining in. Thank you.